Good morning, everyone, and thank you for joining us for this very special event and for what we believe is a historic announcement today in Pennsylvania. I'm Zach Schamberg. I'm President and CEO of the Pennsylvania Healthcare Association, an advocacy organization representing long-term care throughout Pennsylvania. More than 5 years ago, at the height of the COVID-19 pandemic, the long-term care sector was in real trouble. Workforce shortages had been exacerbated. Medicaid reimbursement disparities had been revealed. Access to care issues had been accelerated, especially as nursing homes across the state began to sell or go bankrupt or close their doors altogether. In an aging state like Pennsylvania, this was a real problem. After all, today, our fastest growing demographic is age 80 and older. Demand for long-term care can very quickly outpace supply. It became clear that if there was going to be positive change within the long-term care continuum, then the various stakeholders within that continuum, including providers and workers, would need to join forces and would need to advocate together on behalf of their colleagues and the residents that they serve. Now, while our organizations have certainly collaborated and worked together throughout the past 5 years, we are very proud to make it official this morning. The Pennsylvania Healthcare Association and SEIU Healthcare have formed a strategic partnership aimed at advocating together, collectively bargaining together, growing together, and perhaps most importantly, preserving the long-term care continuum in Pennsylvania together. Our partnership is built on the foundation of collective advocacy. What benefits providers ultimately benefits and supports workers, and vice versa. We cannot afford to work individually or in our separate silos anymore. And that's why we're proud to team up on behalf of long-term care in Pennsylvania. Earlier this morning, PHCA and SEIU stood side by side and educated lawmakers on our top priority in this year's state budget cycle: strengthening the Medicaid program for our most vulnerable residents and those who care for them. We've asked lawmakers to address a decades-old Rendell-era budget tool, the budget adjustment factor, so that much-needed funding is actually dispersed to our sector, and so that we can then invest in our workers, in our residents, and in the care that we provide. That fight starts with House Bill 1310, which was introduced by State Representative Ryan Bizzarro and would put a floor on the budget adjustment factor to ensure reimbursement keeps pace with rising costs. Senator David Argall is introducing companion legislation in the state Senate. Today, we stand side by side to work together on creating family-sustaining jobs, as well as a sustainable model that can support our aging population. But this is important to note. It can't just be stakeholders. It can't just be PHCA and SEIU working side by side. We need the support of our elected officials. And this morning, I am very proud to say that we are joined by a number of our elected representatives. I want to begin, and I want to call a few folks up to the podium, but I want to begin with House Aging and Older Adult Services Committee Chairwoman Maureen Madden. Someone who understands these issues, someone who knows these issues, and someone who fights for providers, workers, and residents throughout Pennsylvania. Madam Chair.
Thank you. Good morning, everyone. As Zach mentioned, I'm Representative Maureen Madden. I represent the 115th Legislative District in Monroe County, and I have the great honor and privilege to serve as the Majority Chairwoman of Aging and Older Adult Services. And I'm here today with my colleagues and stakeholders to let you know that the Pennsylvania long-term care system is indeed in crisis. And let's call it what it is. It's a crisis not rooted in a lack of compassion or dedication, but in a chronic failure to fund care in a way that is predictable, sustainable, and fair. Our frontline caregivers continue to show up, understaffed, underpaid, and overstretched, while facilities struggle to keep their doors open. Meanwhile, families spend sleepless nights worried about whether or not there will be safe, dignified place for their loved ones to receive the care that they need. And we all know that this is unacceptable. Today, Representative Ryan Bizzarro and I have introduced the Long-Term Care Stabilization Act, Legislation that aims to bring predictability to a system that is currently held together by uncertainty. At the heart of this bill, it is simple. A vital principle which includes budget predictability leads to better care, and here's what the bill does. It establishes a permanent minimum budget predictability it establishes a permanent minimum budget adjustment factor, or BAF, of 0.90, a floor that ensures that nursing homes won't be blindsided by shifts year to year. It ensures that facilities can plan responsibly, invest in their staff, and meet the real costs of care without scrambling to fill financial gaps at the expense of quality or safety. And critically, it accomplishes without increasing the overall budget. It simply protects providers from unpredictability and unjustified reductions in payment. Let's be clear. This legislation does not ask for more money. It asks for more reliability. It says to our care providers, we are listening to you, we support you, and we're going to stop making you guess whether the funds you need to care for our seniors will be there. Too often in this chamber, we talk about fiscal responsibility while ignoring the long-term costs of instability. Every closure, every staffing shortage, every delayed moment in care and in cost will bear financially, emotionally, and morally. We must change this, and we can do it today. This is not a partisan issue. It is a human one. Democrats, Republicans, independents, we all have grandparents, parents, and neighbors, and constituents who rely on this system, and we have a duty to protect them. The Long-Term Care Stabilization Act gives us a real solution. It allows the providers to breathe again, to hire, to retain, and to plan. It protects the dignity of our elders, and it honors the people who care for them. Let's lead with both heart and head. Let's fix what's broken, and let's deliver a future for long-term care Pennsylvania that is worthy of the people that it serves. Thank you.
I've been working on explaining the budget adjustment factor for 11 years. I think the chairwoman did a great job in 10 seconds, so thank you again. Next, I want to call up someone who not only understands this work, who is an advocate for this work, but who has lived this work as a nurse. Representative Bridget Kozarowski.
Good morning, everybody, and thank you for being here with us today. And I must say, bravo to SEIU and to PHCA. Collaborating together to solve and address an issue here in our Commonwealth is something that I'm really proud to be here with everybody. And as Zach said, my name is Bridget Kozarowski. I am a representative from the Lackawanna County area, and I have the unique background of being a nurse and actually working alongside with people like the woman behind me, Tina, working direct care right at the bedside. And when you think of nurses, there's all kinds of nurses. Nurses are OR nurses, pediatric nurses, home health care nurses, traveling nurses, med-surg nurses. But when you talk about long-term care, I always use the story that when I did this kind of work as a young nurse, when I first graduated, I worked in a long-term care center for about 6 months. And having gone to nursing school, you get to kind of get a little taste of all kinds of different kinds of nursing you can practice. And, when you work in long-term care, it takes a very unique, special kind of trained nurse because, taking care of a baby and feeding a baby and changing a baby and helping babies with their activities of daily living is different when you go into a different kind of geriatric setting. There's many more challenges, and it takes patience and a unique set of qualifications to make sure that you take care of those patients, those residents, our loved ones in the best care setting possible. And there's no doubt that we here in the state are challenged with long-term care closing units, workforce challenges, reimbursement challenges. It's no secret that long-term hospitals are closing. Not good here in our Commonwealth. But when the people behind me are collaborating to directly address such a crisis, and I have to call it a crisis because we have a wonderful state here in Pennsylvania, but we have a very high aging population. And we all want to make sure, like Chairwoman Madden said, we all have parents and loved ones and grandparents and uncles and aunts and friends and sisters and brothers that are aging. And we want to make sure if they do need a place to stay and a place to be safe and a place to age in a setting that you know that they're being taken care of. I'm really proud to stand here today and work alongside with the people behind me in this collaboration to get it done. Their workforce is powerful, their mission is powerful, and I have great faith that they're going to be able to do this. They need legislators like myself and people in the Senate and in the State House to work along with them. There's lots of acronyms, the BAF and SEIU and PHCA and long-term. For a nurse like me, this was a lot to absorb when I got here to Harrisburg because my acronyms mean different things. But just know that they all have the same goal in mind, and that is to make sure that we fix and better long-term care here in the Commonwealth. So I'm proud to be here today, and thank you very much for joining us this morning.
Thank you, Representative. You know, for years, when we've talked about senior issues in Pennsylvania, we have maintained, and we've been very clear about this, caring for our seniors and supporting those who care for them has to be a bipartisan issue, or it has to be a nonpartisan issue. This isn't something that just Democrats should be focusing on. It's not something that just Republicans should be focusing on. We need both parties and both chambers within this building to come together to make it happen. And in that spirit of bipartisanship, I'm very, very proud to welcome Representative Tom Mahaffey to the podium to voice his support for this as well. Representative.
Good morning, everyone. I am State Representative Tom Mahaffey. I get to represent the 106th District, which is the sweetest district on earth because I get to represent Hershey. But I also get to represent a lot of nursing homes. And I don't think you can understand the severity of what is going on out there. And I don't think this alarm can be any louder than what it is today until your loved ones need that care. And these folks that work in these homes do a fabulous job, and they're doing everything they can to help you. I experienced this just recently with my in-laws, and it is something, when they took residency at the home, it is a hard thing to do. It is probably one of the hardest things to ask your loved ones to move in to get the correct care they need. But we have to do better. We, as the General Assembly, must. This is a must factor to help fund and do the things we need to do at these nursing homes so we can get the people in there that want to take care of our loved ones the way they should be taken care of. The reimbursement rate in this state is pitiful. We need to do better. We must. And I know what Zach and SEIU are working on right now, and the BAF and all of that goes into this whole factor of making sure that our workers are compensated properly, our health care systems, as far as our nursing homes, are funded properly so they stay open and they can accept residents. Because that's what they are. That's their residency. That's where they live, and that's where they're being taken care of. And if you cannot do that, when you lose money every day, and you wonder why these places are closing. Well, the call that I get more now than ever is, can you please help me locate my loved one into a nursing home, a facility that they can be taken care of like they should be taken care of in their golden years. That is the hardest thing to find and the hardest thing to do right now. Let's help them do this. I applaud Zach and Matt for coming together and doing this. If you guys can come together, the General Assembly should be able to come together, the Senate and the House should be able to come together, and the governor should be able to sign this. Thank you so much. We're here for you. Thank you.
Thank you very much. I also want to call up, and I saw him go for his coffee, so of course I have to call on him, someone who has been a champion for long-term care from his days, not only as a staffer in the Senate, but now in the State House of Representatives, someone who has stood with us for many years, and again, someone who understands what we go through each and every day, Representative Kyle Mullins.
I'm all caffeinated, and I hope it comes through in my brief remarks here, but this is really a special occasion to see two truly incredible organizations, wide-reaching organizations, come together in such a meaningful way. united by a common purpose. You know, I was a little late for this event. I had just come from a House Insurance Committee hearing regarding fertility treatments and hopeful coverage thereof. So we're talking about helping people at starting a family, at the beginning of life. And here I am, the very next item on the calendar of helping people age and live with dignity in some of their most vulnerable time in life. So it's proof that when this building is at its very best, we're helping people. We're talking about helping people, and we're actually doing it. And that's why I'm so proud of the legislation that Representative Bizzarro and Senator Argel are working on, and that these two incredible organizations have come together for. I know we get deep into the complexities of policy and budgets and acronyms, as Representative Kozarowski mentioned, and budget adjustment factors. That what's important to relate and to reiterate among your workforce, among our constituents, is that there are lives and livelihoods behind the decisions we make here. There are lives on the line, and there are livelihoods that depend mightily on getting this done and making sure that we are showing how much we value the profession, your calling of being a provider, of being a caregiver. I know the operators are often called providers and the workforce is called the workers, but let's face it, everybody involved here is a provider of compassion and skilled nursing and care delivery. And we here in government, in the halls of government, should be doing a better job to make sure that you're able to do your job on behalf of our most special constituents. Thank you so much for doing this.
First, I just want to appreciate all of our legislative champions who've joined us here on the stage today. Thanks so much for being out here. If you haven't had an opportunity to speak, good morning. My name's Matt Yarnell. I'm president of SEIU Healthcare Pennsylvania. We bring together tens of thousands of healthcare workers all across the Commonwealth, and of our membership, 9,000 of those folks are nursing home workers. I couldn't be more proud to announce our partnership today with the Pennsylvania Healthcare Association, along with responsible operators. We are looking forward to other operators joining the cause. And the purpose of this partnership is to win the kind of improvements that residents need across Pennsylvania. Improvements to staffing and to quality care and to ensuring that workers have a seat at the table to make sure the funds that we are winning are invested in making these good jobs. The best way to continue to drive transformation in our nursing homes is to win the resources and direct them where they need to be, and we need to do that together with operators. We're in a moment where all of our efforts should be spent on solving the workforce crisis, and we are committed to that. This partnership is a formal commitment to do just that together. And frankly, our nursing homes today are not prepared for the growing demand of care. We've heard this from some folks already. And we need the care options for the aging population in Pennsylvania. And just to pause for a moment, Tina said this earlier, and we'll probably say it again today. Just since 2021, we've lost 30 skilled nursing facilities across Pennsylvania that have closed, shuttered their doors. And we think that's the tip of the iceberg, and we'll continue to see more closures advance. And we also, at the same time, don't have the skilled, trained workforce to meet the growing needs for the number of people who are going to need skilled care into the future. And so the reason we're talking about the, BAF, the budget adjustment factor, is we have made a tremendous amount of strides, and the Pennsylvania legislature, both sides of the aisle, have passed significant funding for nursing homes over the last several budget cycles. And one might say, well, why are we still talking about not having enough resource? And the challenge is the budget adjustment factor, and the money that we have won has not made it to the bedside like we need it to. And so that is why we need to set a floor on the BAF in this budget cycle, and we're calling on the representatives of both chambers and our governor to do just that in this cycle. Oftentimes, we still struggle with turnover in this workforce. Oftentimes, the majority of the workers in nursing homes are women. Many of those women are going to work, many of them for about $18 an hour, caring for an aging population, caring for a sicker population, and then going home and trying to raise their own families. And we know if we're going to get people to do this work, we have to continue to lift wages and make this family-sustaining work as we walk forward into the future. Last thing I just want to say is, again, we've done a lot of work together. We think it's really important to partner with PHCA and responsible operators. We look forward to growing together. We look forward to having a more strategic approach to all of our work, and look forward to having a more strategic approach in this House, in this chamber, to figure out how to get really important things done and to transform nursing home care in Pennsylvania. And so with that, I'm actually going to turn to a 40-year nurse, Tina Siegel, who has gotten up for 40 years and cared for folks in the nursing home that she's worked in Claria, Pennsylvania. I think it's really important folks hear from Tina about her experiences and why this work is so important. And we look forward to working with PHCA and the Pennsylvania legislature to get this work done and transform nursing home care into the future. So Tina, great.
Thank you. Like Matt said, my name is Tina Siegel. I've been an LPN for 40 years. I've worked at the same facility for 40 years. And I'm getting to the point where now I just recently did like a partial retirement. And I'd like to think at this point in my life that I've been able to make a difference. And now that I'm partially retired, I want to spend that time putting more time into ensuring that our residents, who also we consider family, to get the care that they deserve. And that's why I'm here today. As we said, Pennsylvania residents are getting older. And so, like Matt said, by 2035, our older population is supposed to double. We don't have the workforce now to care for our residents like we should. We don't have workforce that's trained in the different areas. We no longer have just an older population like our grandma and grandpas. We have younger people, whether it be from drug abuse or people who have just not had health care, so they have underlying issues that have caused serious conditions. We have people that have been in accidents, or we just have people that are coming in from rehab. They've been in the hospital, they've had surgeries, so they require more acute care, and they take longer to do that care. And you have to be more specialized in taking care of these things. So it takes more time, it takes more staff, and we don't have the trained caregivers. In my facility, we've been lucky. We had a lot of long-term care dedicated staff, but a lot of those, like myself, are retiring, or some have been burnt out. I might have liked to have stayed on longer full-time, but it's just getting too much right now. And not as much physically as mentally, because you go home and you know you haven't been able to do everything you should have been able to do for that resident. So that bothers you emotionally. And like I said, it's trouble getting staff. We've talked about closures. A facility in Clarion County just closed this past spring. So even though we didn't have enough staff to begin with to take care of the residents we had, we got residents from that facility that closed. They were moved from a home that they were comfortable in and moved to our facility. So we tried to make them comfortable. You try to spend time with them. Because of that influx of residents and already not having a lot of staff or staff that are retired, and those positions were never filled because somebody doesn't want to do it. Or you can go to, somebody younger can go to McDonald's, Walmart, or Sheetz, make the same amount of money, but not have to put up with the physically and mentally challenging job. So in that instance, we've had to use agency. Agency is unreliable. Yes, there's good nurses or CNAs out there who work for agencies, but a lot of times they don't show up. Or some have even been heard saying, I'm just here for the paycheck. You know, the residents that what basic care I'm here to do, and some have even said, I'm not doing a shower. I'm not showering residents while I'm here. They get 2 showers a week, and if they don't get showered that day, then they're not getting showered. And it's also difficulty to have agency. You have a call off in the morning. Our agency comes from Newcastle, Butler. That's a long ways away. So you're going to do without that care for that short, for some of the time. So it's like we never had a revolving door, but I want to say that's what we have now. There's definitely an instability in the workforce because of facilities closing or facilities being sold. You know, I was just sold this past year to a new company. And the facilities have a rough time also. It's like, as staff, we bring in snacks and drinks for the residents and personal items because they're like family to us. And we know that they like those things. They don't want to just drink water 24 hours a day. And then when we do go to give our care, it's not the care that these residents deserved. We're rushed through our care. We are feeding 2, sometimes 3 people at a time. If you're in the dining room, you have them sit around a table and so their food can also be cold. Or I've even had girls that are in the hallway. They're in one room feeding a resident while that resident's chewing. They run across the hall to give the other resident a couple bites and then come back. Or we have residents that you set up because they can start, but then they tire out. Till you get back to them, their food is cold. We have residents that can't speak for themselves, whether they've had a stroke, they have dementia, they have Alzheimer's. They need the direct care staff that's able to check on them frequently, to reposition them. They could be in pain from the way they're laying, and just a simple reposition will help that pain. But if we don't get in there frequently, they're laying in pain. Or they're incontinent, and they have to lay in that soiled linen and develop bed sores from that. None of us like to see that. And also, it's just a difficult, even residents that are alert and oriented and can speak for themselves, they'll put their call bell on, but we're busy with other residents. We don't get to their call bell. They might try to take themselves and then fall and get injured. In the elderly population, a fractured hip could end up in death. Or a resident, they just become incontinent. That's a dignity issue. That resident, if you had the time to take him, would not be incontinent. Think how that would make you feel. If you got to the bathroom, you'd be all right, but you have to sit in your own urine. That's why I'm here today. You know, I love my residents. I love doing what I'm doing. I'll go on vacation and I'll come back and different residents will say, "Where have you been?" You're not allowed to go again. You know, that makes me feel good because I know I have made a difference in their life. And we have, like I've talked about, made reforms recently since the pandemic. You know, we've had these issues in nursing homes for years, but it's like nobody listened until the pandemic hit. When that was brought to the spotlight, you know, nursing homes were brought on TV or wherever. People saw what actually was going on. So we have had increased funding, but we need to change how that is dispersed to facilities. We need to work together to build this momentum. Like I said earlier, we make a few steps forward, and then we fall backwards. We don't need that. We want this to continue forward so that we know that all of our residents are getting the direct, dignified bedside care that they deserve. And that's why I'm glad to be a union nurse. I'm here to advocate for my residents, and I'm glad that industry leaders and our union have committed to work together. Because I know firsthand that when employers and workers, whether it be a whole company working together with its workers, or just it makes a difference inside your facility with management. If you work together, good things can be accomplished. And because of that, that's what helped our facility, because we had good working conditions with our management, keep those workers there because they know they were respected. And it made morale better to make those workers to stay in the facilities. So we need to do more of this, and we need to do it together. Thank you.
Thanks, Tina. Well put. I again want to just thank Chairwoman Maureen Madden, Representative Bridget Kazarowski, Representative Tom Mahaffey, Representative Kyle Mullins, and the other elected officials who joined us today and who took time out of their busy schedules to stand with us. I think you've heard overwhelmingly this morning that the system is broken, but we can fix it. And PHCA and SEIU and those in the legislature, we hope, will stand with us to do just that this year. So thank you again for joining us. If there are any questions, please let us know, and we look forward to working together over the next few weeks. Thanks.